Good morning, everyone. So today we're going to be working some gentle hip mobility, getting into laying on our back, getting into the figure four position. Got a few nice movements that will work in trying to get into the kind of the deep rotators of the hip, trying to get them to be a little bit more mobile, a little bit more pliable. Usually helps with improving low back stiffness, tightness, and soreness as well. So let's get started. We're going to start on our back, and we're going to get into our crocodile breath first. So with crocodile breath, I want to make two nice big C shapes with my hands, placing the hands below the rib cage and above the hip bone in that nice kind of meaty section of the abdominal wall. I want the thumbs to be in the back so that we can kind of push into that low back musculature just a little bit. Index fingers are wrapping around to the front so that we can press into the belly musculature just a little bit. And palms are going to be pressing into the side. So we have 3 points of contact: low back, belly, and side body. Both hands. I want to lightly cinch the hands down so that we can create some resistance for the inhale phase of our breath. So we're going to do a nice slow inhale in through the nose. And as we inhale, I want to feel that abdominal wall expanding out like a balloon or like we're breathing like a crocodile. As we exhale, we're drawing our navel up and into the spine and allowing the hands to kind of clench down again so that we can create resistance for that next inhale breath. And we're going to go with a good 5 up to 10 slow inhales and slow exhales. With each one, we're going to see if we can slowly expand the wall of the abdominal wall a little bit bigger and a little bit bigger so that when we get to that last breath, we're getting as much expansion through that wall as possible. So nice inhale in through the nose to start. Nice slow exhale out through the mouth. Again, drawing that navel up and into the spine. Let the hands clench a little bit. And feel that inhale breath pushing the fingers out and away. I want to see if we can feel the thumbs moving, the index fingers moving, as well as the palms moving with that inhale breath. As we get a few breaths in, we can start to kind of notice or assess, does that breath move better to the right side of the body or does it move better to the left side of the body? Especially into the thumbs, getting into that low back, or into the palms straight out to the side. You might notice that one side moves or expands a little bit more or a little bit better than the other side. You might notice that one side does not move at all. If you're feeling that for right now, we're just assessing. You can bring some intention of your breath to see if you can get those areas that aren't moving to move a little bit more. And more importantly, we're going to come back and do this breath again at the end of the class. And we're going to see if we can get it moving a little bit better with our mobility work. So we'll go ahead and let the hands relax down to our side. We're now going to get into a little bit of happy baby, or just gentle happy baby, bringing feet off the floor, grabbing our knees. We're going to continue with that nice breath, crocodile breath, letting that belly expand up. Allow the hips to rock forward so that the knees move to your feet. And as we exhale, drawing that navel up and in, lightly pull the knees towards your chest. Inhale, allow the knees back out. And with each one, we're seeing if we can pull the knees a little bit tighter to the chest and seeing if we get a little bit of scoop from the pelvis. Can we feel the sacrum lightly getting pulled off the floor? want to see, we're trying to work into a little bit of low back mobility. Can you feel some stretch into that low back on that exhale phase as you pull the knees in? Now, I want to make sure that the head and the shoulders are fairly relaxed on the floor and are not lifted up or straining. If you find it difficult to keep your head and shoulders relaxed, it's okay to place a bolster, folded up blanket, or pillows just to allow your head to be able to relax more. You'll probably need that bolster getting into the rest of the movements that we're doing. Once we get about 10 breaths in, we're going to bring our feet back down to the floor, and we're going to bring one ankle, go right ankle, up to knee. So I'm starting with my right ankle on my left knee, basically making a figure 4 position with the hips. And from here, we're going to start with very gentle rocking of the knee. As I inhale, I'm bringing my knee towards the chest. As I exhale, I'm pushing my knee away towards the wall at my feet. Inhale, rocks the knee in. Exhale, reaching that knee away. And I want to see if we can feel that kind of light mobility deeper in the hip socket. I want to make sure it's not painful. We're not moving into pain. I do not want any pain that elevates to a 3 or above on a scale of 0 to 10. So I want to make sure that we're moving within a comfortable, I like thinking about it more like a juicy range of motion where it feels good and pleasant, not painful. Once we get 5 to 10 reps, we're going to slowly switch to the other side. Again, ankle on knee. One thing to kind of notice with ankle on knee right away is that position where the knee wants to sit. You may find that one hip is tighter and that knee sits closer to the shoulders and the chest, and it's harder to get to reach down to the feet. That's going to be a pretty important balance issue to pay attention to. So inhale, we're bringing the knee closer to the chest. Exhale, reaching the knee away. Again, feeling that kind of deeper in the hip socket. Keep the movement slow. I'm still doing nice slow inhales and nice slow exhales. And I want to keep that movement timed with my breath. So as I'm inhaling, I'm pulling the knee in. As I'm exhaling, slowly, I'm reaching the knee away. Once we do 5 to 10 reps on this hip, we're going to switch back to the first hip again. So now I want to actively keep that knee reaching away to the wall. So I want to keep that light tension in the hip. So as my right knee is reaching away, I'm now going to lift my left foot and pull my left knee towards my chest. I can do this just using my core, or we can use our hands to assist a little bit. You can either grab the knee or grab the ankle. As we exhale, we're pulling in. As we inhale, we're letting that hip back down. You can let the foot back to the floor on each one and then bring it up on the exhale. Or you can just allow that hip to soften a little bit and exhale.
This thing. You're supposed to do 5 on each leg.
I'm hearing somebody on audio. Is there a question? Maybe just somebody is unmuted still. So once we get a good 5 to 10 reps, we'll switch back to the other leg, doing the same thing. Again, actively reaching that knee away so that we have some tension in that left hip, and then lifting the right knee up, pulling it into the chest. Again, we can use a little bit of assistance. You can grab the knees, grab the ankles, and lightly pull. Inhale, letting it back out. Exhale, bringing it in. Should feel this as a nice little stretch kind of in that glute of the leg that is in the figure 4 position. Once we get 5 to 10 reps, we're going to come back down and we're going to switch again, coming right back to that figure 4. So right knee, ankle is back on that knee. At this point, we're going to let that leg shift so that instead of the ankle being on the knee is really about mid-calf level. And we're going to do some of the same things as far as pulling that knee into the chest, except we're going to grab that opposite knee. So I have my right knee up. I'm going to use my left hand, and I'm going to lightly pull that knee towards my left shoulder at the same time that I'm using my left knee leg to pull towards my chest. So I have two kind of angles of pull here. Inhale, I'm letting it out. We're letting it soften. Exhale, pulling in with the left knee at the same time that the left hand is drawing that right knee across the shoulder towards the opposite shoulder. If you're able to get those two directions of pull at the same time, again, we're going to feel that in that glute, but a little bit deeper in the glute. And really, we're kind of getting more into like deeper muscles like the piriformis, around that sacrum. Again, this should feel good, juicy, pleasant, not painful. We'll switch to the other side. Again, letting that leg slide so we're kind of on the mid-calf. Now the right knee is pulling up and the right hand is coming across the left knee. As I pull the right knee in, I'm also pulling the left knee across towards the right shoulder. Continuing with nice, slow inhales, nice, slow exhale. This is a good movement to notice if one hip feels a little bit tighter than the other hip. That's going to be pretty important, especially if you have any kind of hip or low back issues. If you get any kind of sciatic type pains that move down the leg, this is going to be a big movement to assess. All right, we're going to come back to our first leg. So I got my right ankle back on my left knee. Again, I want to actively reach that right knee away so that we have that hip in tension. We're going to let our hands come out to the side with the palms up. And now we're going to do some rotation through that hip. We're going to let the hip rotate towards the left. If you got the right ankle up, you're rotating towards the left as if you're trying to put that right foot to the floor. And I only want to go as far into this rotation as I'm able to keep my shoulder on the ground, and then I'm bringing it right back up. We're exhaling as we allow it to rotate. Nice, slow exhale. Inhale as we're bringing it back. And with each one, see if you can get a little further into that rotation without going into pain. Again, comfortable, juicy. This feels good, pleasant, not stressful, not painful. As we get to 5 or 10 reps, we're going to get into this rotation. I want to stay at kind of a light tension of that rotation. And now we're going to come back to that kind of that knee rock, pulling the knee towards the chest and then reaching the knee away. But I'm doing so in rotation. Once we do about 5 to 10 reps, we'll come back up and we're going to switch legs. So left ankle on right knee, reaching that knee away to get some light, get the hip a little bit in tension. Arms are still out to the side, palms up. Nice slow exhale as we let the hips rotate towards the right. Inhale as we bring them back up. As we exhale, again, I'm rolling as if I'm trying to place that foot flat to the floor. And I'm only going as far as I can without my opposite shoulder getting lifted up off the floor. If you're able to get that foot all the way to the floor, great. If not, don't force it. It's more interested in exploring the range of motion than getting to the floor.
No, you're supposed to go to the floor.
On the 5th or 10th one, as we move to that side, we're going to get into light tension and we're going to hold it. And we're going to play with that knee again, pulling it towards the chest and then slowly reaching that knee away to the wall. Once we get 5 to 10 reps, we're going to rock back up, bring our feet flat to the floor. Now we're going to come up to a sitting position. So tall sit, legs in front. We're going to see if we can bring one foot up flat to the floor, and then we're going to move that foot across to the other side of the knee. From here, I got my right knee up. I'm going to take my left arm and wrap it around that knee. And I want to try to grab with my forearm so that I can pull that knee towards my shoulder. So I'm pulling right knee towards the left shoulder. At the same time, I want to try to maintain as much of the height of my spine. So opposite hand can kind of come down to the floor to support. We're going to do a nice inhale, and we're going to allow that knee to open up, kind of soften. On our exhale, we're pulling and getting tall at the same time. I'm pulling that knee towards my left shoulder. I'm also trying to bring that left shoulder to my knee. So I have some rotation in my upper body at the same time that I'm pulling that knee in. So we should feel some of that stretch through the outside of that hip, maybe a little bit of that stretch into the back and the spine. Inhale, we're letting it soften. Exhale, as we pull, we're getting our spine as tall as we can. We're turning that shoulder into the knee as we pull that knee into the shoulder. Again, I kind of want to feel this through that outside hip and then a little bit maybe into that low back. Once we do about 5 to 10 reps, we're going to switch to the other side. So again, bringing that foot across flat to the floor. Opposite hand is wrapping around so that we're grabbing that knee with our forearm, pulling that opposite shoulder into that knee. Opposite hand can come down to the floor in order to support. Nice inhale, allowing that knee out. Exhale, pull. As we pull our shoulder to the knee, we're pulling the knee to the shoulder, and we're trying to get tall through the spine all at the same time. Notice if this hip feels a little more or less tight than the other side. Notice if you feel more or less tightness and tension in the low back. This side of my left hip is looser than the right side, which is interesting because it's the inside of my left hip that is tighter than the right side. So it's interesting how I have tightness and tension and a little bit of looseness on both sides. I'm going to get into our quadruped position, getting onto hands and knees. I want to spread hands nice and wide, ground palms, and extend the elbows as much as possible without locking them. And we're going to get the toes tucked underneath in the back as much as possible, especially the big toe. We're going to start with a little bit of toe mobility, getting into the arches of the feet. Starting with our breath, I want to come back and kind of focus, get some expansion into that abdominal wall. So nice, slow inhale, fill that abdominal wall up like a balloon. Exhale, drawing that navel up and into the spine. Basically doing the same breath we did at the beginning. We just don't have our hands in place to feel it. On your next inhale, start to rock forwards a little bit, kind of feeling a little bit of that rock into your wrists. And then on the exhale, allow your hips to rock back towards your heels, keeping those toes tucked. I want to kind of feel the weight of our hips, specifically in the toe joint. Feel it load into that joint just a little bit. Feel some stretch, mobility into the big toe, maybe into the arch of the foot. Inhale, we're rocking forward. Again, feeling that load more into the wrists. Exhale, rocking back, hips to heels, getting into the toes. As we go back and forth with each one, see if you can sink into it a little bit deeper without going into pain. Again, I want this to feel good, juicy, pleasant, not stressful, not painful. And moving slow with the breath. I want breath to be slow, and I want our movement moving with our breath, which keeps it slow. Once we get about 5 or 10 reps moving into that big toe, we're now going to let the heels kind of roll out a little bit so that we can try to get tucked underneath to those outer toes. See if you can get the pinky toe tucked onto the floor so it's not kind of hanging out free, floating free. Can you get that pinky toe tucked underneath? And we're going to do the same basic thing. Inhale as we're forward. Exhale as we slowly feel the hips rocking towards the heels. Inhale as we come forward, feeling that load more into the wrists. And then back into the toes. And with each one, see if you can get a little bit deeper. Can you get a little more of that juiciness stretch out of the feet, getting into the arches of the feet, again, without getting into any kind of elevated levels of pain. Once we get 5 to 10 reps, if you need, it's okay to come off the wrists, give them a little bit of a break. We'll spend another minute or so or two in quadruped on the wrist. So I want to make sure that they're not feeling overwhelmed. We're going to come back to hands, keeping the toes tucked, but we're now keeping the hips over the knees and the shoulders over the hands. Coming back into our breath, we're going to do some pelvic tilts. So on our inhale, allow that breath to move more into the belly. So the belly starts to move to the floor. The pelvis is going to tilt down to the floor so that we get some light sway in the low back. As we exhale, drawing that navel in, we're also scooping the tailbone. Inhale, pelvis tilts forward. Exhale, tailbone scoops. One analogy here is if you think of your sacrum as the palm of your hand, your fingers are your tailbone. So as we exhale, I want to move those fingers towards the floor, feeling that scoop. I want to make sure we are avoiding pinch and pain in that low back. So we're only moving as far through this this tilt, forward and backward tilt, without pain and without pinch. And with each one, we're seeing if we can get a little bit more opening towards the floor. Can we get a little bit more active scoop? And notice I'm really keeping this movement located into that low back. I'm not letting it get up into the shoulders just yet. We're going to get into the shoulders here in just a second. So now with each scoop, I want to start to allow that movement to move a little bit further up my spine, moving up to the shoulders. So as we exhale, see if you can let that move up kind of towards the ribs by really scooping. Can you feel it stretch a little higher? Inhale, bringing it all the way back. On the next one, as we exhale, can you feel it move all the way up to the shoulder blades? As it does so, you can lightly push through the palms into the floor. And then inhale, feel that belly moving back down to the floor. On the next one, as we exhale and push, can you feel that push move all the way up to the neck? Head will start to reach to the floor. And on the next one, we'll start letting our head come up. As we exhale, I want to continue to reach so that we're trying to touch our tailbone and our forehead at kind of this imaginary point in the middle. So I'm letting that movement come across the top of my head, scooping with the tailbone, reaching with the forehead. Inhale, bringing it all the way through. Allow that head to come up at the top. Now we're kind of getting more into that full cat-cow. Good. All right. We're going to give you a little bit of a break on the wrist real quick, and I'm going to show you what we're going to do next. We're going to come back into that cat-cow position, and we're going to start doing what I call cat-cow circles, but we're going to start by moving the ribs side to side. So kind of imagine that my hands are on the ground. I'm in my quadruped. We're going to start with glide of that rib. I want to see if I can move that 12th rib side to side, but I want to move that 12th rib without moving the hips side to side or without moving the shoulders side to side, which was going to can be really challenging at first. You'll probably find the hips and the shoulders are moving considerably. After we get into that glide, then we're going to come back and we're going to add in the cat-cows with that glide so that we're turning it more into a circle. So we'll come back to hands. Toes are still tucked underneath in the back. And we're going to exhale as we reach that rib cage out to the right side. Inhale as we bring it back to the center. Exhale as we try to shift that rib out to the left side. And again, I don't want my shoulders moving back and forth. Okay, if the shoulders are moving to where they're extended over the hand, beyond the hands, then you're moving too much from the shoulders. Same thing with the hips. I don't want the hips moving to where they're extending beyond the knees. I want to feel that movement just from the ribs. The shoulders and the hips will move a little bit because the ribs are moving, but they're not moving them. You're not using the shoulders and the hips to move the ribs. See if you can feel that light stretch through the outside of the rib cage into that low back. As we start to feel that open up and mobilize a little bit. Next one, as you reach to the side, then you can get into that scoop. Reach up to the side, the ceiling, and you're going to carry it all the way across to the other side. Then you're going to let it move down to the floor. You can think of this like your spine is a jump rope, and you're trying to make a big spin of that rope. Keeping hands well grounded to the floor, toes are still tucked. Slowly move to make that circle a little bit bigger without going to pain or pinch. Nice slow inhales, nice slow exhales. I like my inhale at the bottom as my belly's opening up to the floor. I like the exhale at the top as I'm scooping and reaching up to the ceiling. Once we do 5 or up to 10 reps in this direction, we're then going to reverse direction of our circle. Again, nice slow inhale, nice slow exhale. This movement is a good one to kind of notice, where do you feel tightness and restriction in this circle? Is it more out to the side? Do you feel it more on the left side, or do you feel it more on the right side? More than likely, where you feel that greater tension on that side is going to be congruent with where you're also feeling more tension in the hip. Again, those are important. If the hip's tight, it's going to lead to low back tightness. If the low back is tight, it's going to lead to hip tightness. So we want to mobilize both of those areas independently and together. All right, we're now going to get into a different position. We're going to get into our V-sit. So I'm getting into a nice wide, opening up the legs as much as comfortably. Going to actively pull the top of the feet back like you're trying to fold your feet back to your shin. So it's an active pull. Actively reach the knees to the floor. I'm pushing my knees down at the same time that I'm pulling my feet back. The hands come down behind the hips, grounding down to the floor. And what I want to get a little bit of, I want to let those elbows spiral out and away so that the elbow pits are turning out away from your body as much as possible. That will help to pack the shoulders. I want the shoulders rounding down so that your chest is opening up as much as possible. I want to be in as tall, nice tall spine position. And we're going to start with just some rotations through the legs, kind of focusing on the kneecaps. We're going to let the knees turn in as if you're trying to touch your kneecap to the floor inside your legs. And then we're going to spiral out like we're trying to touch the kneecaps to the floor on the outside of our legs. Inhale is going to be as the feet come up to the center line. Exhale as we rotate in. Inhale as we come back up to center, and then exhale as we rotate out. So again, I want to go nice and slow. We are working deep into the hip rotators. So that's part of the reason I want to focus on the kneecaps. I don't want to turn from the feet because I can get a lot of movement at my feet without moving my hip at the level of the hip. If I move my knee is traveling. That means my hip, the femur is spinning inside that hip socket. And with each one, we're seeing if we can kind of squeeze into it a little bit more and noticing how tight is the right side compared to the left side. You can actually look at your kneecaps and see, does one kneecap travel further when you roll out? Does one kneecap travel further as you roll them in? Is it the same kneecap? Or is one knee move better in external rotation and the other knee moves better in internal rotation? Again, that can be a very, very useful assessment point. Now we're going to start to bring some ankle mobility into this. We're doing the same movement from the knees. As those knees spiral out, we're then going to lightly point the toes. As our knees spiral in, we're pulling our toes back towards the shin, making a circle at the ankles. I want to kind of make sure that we're avoiding any kind of like Charlie horse in the arches of the feet. So if you feel some tightness or some tension building in the arch, go easy on this, lighten up. If you're not feeling that tension, then we can add a little bit more. As we point the toes, we can start to flex the toes as well, gripping the toes as we reach, like we're trying to really reach and extend those toes as far as forward. Then as we pull back, we can open and spread the toes as wide as we can. Point as we reach. Again, I don't want to engage a Charlie horse. If you're feeling one of those, then back off a little bit. Once we get about 5 to 10 circles in one direction, we're going to reverse the direction of our circle. I still want to try to get as much spin through the knees, internal to external, but really I want to feel this nice kind of flossing effect at the ankles into the feet. Should feel really good and pleasant. This should not be painful or stressful. Good. Once you get 5 to 10, we're going to kind of come back up to our starting point, actively pulling the feet back, actively reaching the knees, except we're going to bring hands off the floor to bring them in front of the body. And we're going to get into a little bit of like soft forward folds. So nice inhale into that crocodile breath. On the exhale, as we draw the navel up and in, we're allowing those hands to slowly slide forward. Inhale, we're bringing those hands all the way back up. Now, as I fold forward, I don't want to reach my head or my chest straight down. I don't want to round my back. I'm not going straight. I want my spine remaining tall. So I'm just letting those hands slide. If you only go a couple of inches, that's fine. Inhale, bringing it back up. With each one, we're seeing if we can get a little deeper without going into stress or pain. Once you've gotten a good number just going forward, we can start to move a little bit off the center line. But when I move off the center line, I kind of want to keep my hands square with my shoulders. So I don't want my hands to move to the side, but my shoulders to remain square. I want to turn my shoulders with my hands, reaching both hands evenly. Inhale, bringing it back up, and then turning to the opposite side. And this is more of an explorer. We can stay close to center, just barely moving a little off center to start with. Nice slow exhale, nice slow inhale. And we can slowly build out a little bit wider, moving closer and closer to our heels. This is a great one to kind of assess, how does this feel through the right back line of the leg? Do you feel it more in the hamstring, back of the knee, calf, or low back? Is it greater on the right side? Is it greater on the left side? And again, I want to kind of stay in that soft, juicy area with this. I don't want to force it. As we're getting wider and wider, we can start to reach more directly out to the heels, letting one hand on either side of the leg. Again, keeping that shoulder square with it to the best you can. The more you keep that shoulder square, you're going to get more stretch into that low back and even into that opposite hip that you're reaching away from. So I can get this stretch of the direction I'm folding, as well as some stretch in that opposite hip and in that back, low back area. And noticing how it's different on the right side compared to the left side is relevant. So I kind of want to keep those things in my attention. Good. All right. So now we're going to come into our shin box position. So in shin box, I'm basically making a box with my shins. It's also known as kind of like a 90-90 position. I'm in my left side shin box. I'm going to bring my left hand to the floor just outside of my hip. I want to do that same elbow spiral, letting that elbow spiral out and away so that the shoulder blade kind of draws down and back, and we can get nice and tall in our spine. We're going to take some nice inhale through the nose, again, filling up that crocodile breath. Exhale, drawing that navel up and in. On our next inhale, as we exhale, we're going to lift our back knee up towards the ceiling slowly. It's going to get into that deep hip rotators again. Inhale, letting that knee down. Exhale, nice slow lift and squeeze. I want to make sure that we're not turning our shoulders as we lift that hip. I want to be solid through this shoulder, solid with my core. I'm simply opening up that hip to see how high can I get it? How tight does it feel? Notice the height of this knee. We want to compare how much mobility we have in this hip to our other hip. Once we get a good 5 to 10 slow reps, We can slowly move to the other side. Nice windshield wiper takes us to the other side. Hand comes down, grounds to the floor, spiral that elbow out and away. Feel that shoulder blade packed down and back in a nice tall spine. Inhale into that crocodile breath. Exhale as we draw navel to spine. On that next inhale, as we exhale, slowly lift that knee to the ceiling. Again, start small, work each one to squeeze a little bit more range into that lift. Keeping solid in the upper body so that we're not moving. I don't want to open that shoulder as I'm lifting. I want to stay nice and square through the shoulders and chest and just isolate the lift at the hip. Is this hip tighter or more mobile than the other side? Again, all of these are very, very relevant, especially if you're dealing with hip or lower extremity discomfort, pain, or some low back issues. More we can get these things moving in balance, right side to left side, we bring the body into a little bit better sense of equilibrium. We tend to move a little bit more efficiently, which creates less stress, less irritation, less inflammation. We're going to come back to our starting side. So I'm back in my left side shin box. We're going to do some folds. So I'm going to kind of use the knee as my arrow for folds on this side. So I want to turn my chest so I can square to the knee that's in front, placing hands equally on either side of that knee so that, again, I want to square my chest as much as I can to the floor. You may feel some stretch into the low back. Now on our, take a nice inhale into that belly. On the exhale, we're going to let those hands slide forward, keeping square, reaching the chest through that knee. Inhale, we're bringing it all the way back up. Exhale, nice, slow forward fold. And with each one, we're going to see if we can go a little bit further, a little bit deeper without going into pinch or pain. Notice, where do you feel that tightness, tension? Do you feel stretch in the back of that front hip? Do you feel it more in your low back? Once we do 5 on this side, again, we can do a nice slow windshield wiper across to the other side. So that now we're on the right knee, bringing hands out to square the shoulders to that knee. Right off the bat, notice if that low back feels tighter in this direction, or does that hip feel tighter in this direction? Nice inhale into the belly. On the exhale, slow, easy forward fold, reaching the sternum through that knee. Inhale brings it all the way back up. With each one, we're seeing if we can go just a little deeper without forcing it, without going into pain. Notice if this side feels different. Is it tighter? Is it more challenging? Is it easier? Once we get 5 to 10 reps, now we're going to start going back and forth, going all the way back to the left side, into that nice slow fold. Inhale as we bring it all the way back up. Slow windshield wiper transition across to the other side. Exhale as we're in that fold. Inhale as we bring it up. We'll go through another exhale and inhale as we transition, so that as we get to the end of our transition, we're ready for a nice exhale as we fold. Inhale as we come back up. Exhale as we transition. Inhale as we finish our transition. Exhale as we fold. Again, we're moving slow. It's a little bit methodical, but we're maintaining somewhat of a flow to our movement. Once we get about 5 reps back and forth, I'll finish this side. Once we do about 5, we're going to start to open up our shin box angle. So as I come back to my original side, getting into that shin box position, I'm going to let that back leg slide back just a little bit to change this angle, and then coming back to my fold. Now this fold, it's going to feel different in that back hip. It might be tight, it might not be tight, so I want to go easy into it. Noticing how does it feel? Inhale as I bring it up, slide that leg back in so that we can transition to the other side. When we get to the other side, sliding that leg back just a little bit as we get into our fold. And we're going to continue to do that going side to side. Now, as I slide that leg back, I don't need to focus on the knee, on staying square to that front knee as much. Now we can be a little bit more exploratory. Reach and fold where you feel good and juicy. Inhale, brings it back up, sliding to the other side. And as we're going back and forth, we're going to continue to open up that shin box angle. So we'll let it slide a little bit more open and a little bit more open with each one, getting closer and closer to what we would consider kind of a yoga class pigeon pose. But I'm less concerned about that end pose, and I'm more interested in all these different little positions we can get that back hip in as we get into this fold, and what information it can tell us. Does the right hip feel tighter than the left hip? Are certain positions easier than others on the right side compared to the left side? And again, with each one, we're continuing to open that back leg up a little bit more until we get to as far as we comfortably can without pain. I'm going to get one more rep back and forth. Opening up that back leg. Nice slow reach. Inhale, bringing it back. Are you able to get the same amount of reach in that back leg on the left side as you are on the right side? All right, we're going to come back to the floor, onto our back, feet flat, and we're going to get back into our crocodile breath. Make a nice big C shapes with the hands again. Hands going below the rib cage, above the hip bone, so that we're in that nice meaty section of the abdominal wall. Thumbs in the back, index fingers in the front. Nice slow inhale. Fill up that abdominal wall. Feel that wall push out and away into the thumbs, into the index fingers, and into the palms all at the same time, like you're blowing up a balloon. Exhale, draw that navel up and into the spine. Allow the hands to clench down a little bit so that you create resistance for that next inhale. And with each inhale, see if you can expand that balloon a little bit wider and a little bit wider. As you get a few breaths in, start to notice, can you feel that breath pushing more evenly through the hands? Are you getting a little bit more action in the thumbs or in the palms than you did at the beginning of the class? If so, that's a positive sign. That's what we want to see. We've gotten some good mobility into that area. We're starting to get a little bit of a deeper breath. If it still feels tight and restriction, but it's improved a little bit, that's a positive sign. If it feels completely locked down, shut down, then doing some just gentle crocodile breath more frequently throughout the day is probably where I would want to have you start in order to start to build that neurology of expanding that abdominal wall. We can go ahead and let the hands soften down, relax down to the floor, palms up. Continue to inhale into that crocodile breath. But now we're going to let that breath kind of come up into our rib cage a little bit more. Same concept. I want to feel it expanding not just forward into the chest, but also into the upper back and out through the sides. At this point, we can kind of imagine we're breathing into the tension that we feel in the chest or ribs, noticing areas where it might feel tight and restricted. On our exhale, we're allowing that tension to let go, to release to the floor. So again, nice inhale, filling up into tension. On the exhale, allow that tension to just rinse off with that exhale breath. Try to keep that inhale and exhale slow. Last few breaths, just take a little bit of a last scan of the body. Notice any areas that still feel where they might feel tight, dense, or stiff with that breath. You can imagine your inhale is kind of like a flashlight, and you can just shine that light into that area where it feels tight or dense. And again, on the exhale, allow it to go. Just allow that tension to release or melt or rinse off into the floor. And when you're ready, you can open your eyes. Take your time coming to a sit before you come up to a full stand to make sure that you're not dizzy or lightheaded.